and welcome to the Teaching Corner. We've been doing a series on different kinds of therapy and therapists that'll work with our students. And so the last one that I wanted to talk to you about is behavior, a behavioral therapist. Now there are others, and I've done videos on folks who work like specifically with students that are hearing impaired, and I'll put a link to that down below. But these, out of all the different kinds of therapies that are out there, are the most common. So a behavioral therapist obviously works with students that have behavior issues. They typically will work sometimes in two different areas. So you might hear the term cognitive behavioral therapy and ABA, or applied behavioral analysis. And I did a video on the ABCs of behavior and the functions of behavior and how to deal with behavior, which is what applied behavioral analysis works with, and I'll put links to those down below. But you might wonder, what is the difference between the two, and when would somebody work with a student using the two different kinds? So cognitive behavioral therapy is just that. It's cognitive. So it's getting a student to think about what they're thinking and to change negative patterns of thinking into positive patterns of thinking. So that's like the growth mindset. Instead of saying, I can't do this, they might say, I can't do this yet, or I need to ask for some help. It's changing those thought patterns around what they're doing. So this in some ways might look more like typical therapy, where a student or a therapist is going to sit across from the student. They're going to talk, and they're going to tell them about what's going on in their lives, and the therapist is going to go through various things to help them turn things into a more positive light and think about what it is that they're thinking. In order to do this, because it is cognitive, you have to have a child who's old enough to think about their thoughts. So some kids are able to do this at like 7 or 8 years old, but some kids are going to need to be much older in order to do this. And some kids may never be able to do this. If you have a child who is nonverbal or is non-communicative, if you have a child that has no way of expressing those feelings, even if they are verbal, if it's very limited, or if they're using pictures and they're just not at that level. So another thing that you can do with students in that situation is the applied behavioral analysis, or ABA. And this works with a specific behavior. Instead of cognitive behavioral therapy looking at the overall emotional health of somebody and getting more positive thought patterns, this deals very quantifiably with specific behavior patterns. So this might be tally marks that you're taking in class of a student shouting out versus raising their hand. There's very specific data that goes along with this. And again, it can be used with anybody, but especially students who are not old enough to do cognitive behavioral therapy or are not on that cognitive level. So for instance, a professor of mine had a student in a self-contained classroom, and every time she had to go to the bathroom, she would hit herself. Well, that's not appropriate in a public setting to hit yourself in the private area when you need to go to the bathroom. So they modified that behavior by changing it to having her hit her hip, and then they continued to modify that behavior by putting picture cards in her pocket that she would pull out and show when she needed to go to the bathroom. So that's another thing with ABA therapy, is you're always replacing a behavior that you don't want with a behavior that you do want. So if a student is, for instance, constantly blurting out in class, you want to change that behavior and have the student raise their hand. And there's multiple ways, and again, in that video I go into more specifics, but I just wanted you to understand what the difference was between cognitive behavioral therapy and applied behavioral analysis. I hope that was helpful. If it was, please like, share, and subscribe, and I'll see you later. Bye!